So we're going to be talking about immune-related adverse effects that can come to us as optic neuropathies or visual loss. And the reason you need to know this is because patients with cancer, of course, you're always worried that it's the cancer, but sometimes it's not the cancer, it's the treatment of the cancer. And the treatment that we're talking about are the immune checkpoint inhibitors. And you need to know a little bit about what an immune checkpoint inhibitor is before you can identify its side effect. So in patients who have immune checkpoint inhibition, the T cell's interaction with the tumor cell, normally there's a MHC interaction that determines whether you're me or not. And then there's going to be a checkpoint here, and that checkpoint can be the programmed death ligand PD-1 apoptosis interaction. And so this T cell, when he meets the tumor cell, could tell this guy to kill himself or try to kill him with a cytotoxic T cell response or the apoptotic programmed cell death response. So this interaction between PD-1 and PD-L1 is a checkpoint on the immune attack on this tumor cell. And so if you give antibody against either the PD-1 or the PD-L1, you'll remove this checkpoint. And by removing this checkpoint, the T cell can now kill this tumor cell. The problem is sometimes the T cell is not reacting with tumor cell, but with a regular antigen presenting cell. So when the antigen presenting cell makes the MHC handshake with the T cell, the normal PD-1 and PD-L1 response would prevent the T cell from activating against your own body. But if you're blocking the checkpoint, not only are you killing the tumor, but you're attacking yourself. And so this autoimmune attack can cause inflammation in the eye, uveitis. It can cause inflammation in the optic nerve, optic neuritis. It can cause it in the sheath, optic perineuritis. And it doesn't even have to be the eye. It could be any organ system, thyroiditis, lymphocytic hypophysitis. Any type of inflammatory response could occur when you block this immune checkpoint. And so those are immune-related adverse effects. And so any patient with cancer who has an optic neuropathy, your first job is to make sure it's not this cancer by doing an MRI of the head and the orbit to make sure there's no compressive lesion. If there's enhancement of the nerve, you still need to consider doing a lumbar puncture to make sure it's not carcinomatous meningitis. That is, the fluid is containing the cancer, not a mass lesion. And if it's not the cancer, it could still be the treatment of the cancer. You're going to go to that med list and look for the immune checkpoint inhibitors to make sure this is not an immune-related adverse effect from blocking that checkpoint.